If you suffer with osteoporosis, doing exercises is vital to help you increase your bone density. But there are some exercises you should avoid because they increase the risk of a fracture. In today's video, I'm going to reveal what those exercises are so you can safely avoid them and give you some safe alternatives. If you don't know who I am, my name is Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today we're going to be talking about some of the exercises you should avoid if you have osteoporosis. Now, exercises are very important for osteoporosis sufferers because they increase bone mineral density when done over time and they reduce your loss of bone density. But if you choose the wrong ones, you can put yourself at a risk of an injury such as a spinal fracture, which is much more likely in people who have osteoporosis. So today I'm going to show you some exercises to avoid to help you avoid a dangerous spinal fracture, and I'm going to give you some alternatives to do instead in case you're already doing these ones. Now, before I show you the exercises, I just wanted to let you know that the advice in this video is not suitable for everybody with osteoporosis. Make sure you get checked out by your doctor before you try any of these exercises, and definitely avoid them if they cause you any pain. Now that that's been said, let's have a look at the exercises to avoid and the alternatives. The research shows that some sufferers of osteoporosis are at higher risk of a spinal fracture in certain positions and with certain actions. And one of those actions is flexion of the spine, particularly when it's loaded. So that means when you're holding weights. Now, that doesn't mean that all flexion movements are bad. It just means that without due care and attention, we are increasing the risk of spinal fractures if you have osteoporosis, particularly if it's severe. So some of the exercises I'm going to show you to avoid today are ones that involve spinal flexion, but I'm going to always try and give you an alternative that's much safer to do at home. So the first exercise that most sufferers of osteoporosis should avoid is the Pilates roll down. And the Pilates roll down looks something like this. So you start standing often, and often this is in a Pilates class. You have your hands on your legs like this, and you start at the top of the spine and roll yourself all the way down like this. And I actually really like this exercise for most people. I'm going to show you from the side. It's a great exercise to improve spinal mobility, and it's a great exercise to help to prevent lower back pain and to give you a nice stretch. However, because you're going into such an extreme spinal flexion position, if you have very severe osteoporosis, this can increase the risk of a fracture. Now, not everyone should avoid this exercise, but if you choose to avoid it, I'm going to give you an alternative. Let's have a look at that now. A great replacement for the Pilates roll down is the knee hug. And this is a lovely exercise because it does involve a little bit of spinal flexion, but it's much more gentle. It's not weight bearing, so it should be safer for most people. And it gives you that nice relaxation effect of the spine as well. So you start lying on your back with your knees bent. One knee is going to come up like this, and you can hold in front of the knee or behind the thigh, whichever is most comfortable. I'm going to hold here, and then you're going to bring the other one up as well. And then you're going to hug your knees into your chest like this. You can just allow the bottom of your spine to slightly roll up and then relax. And I like to repeat that probably 10 or 15 times in a row. Again, this is just a mobilization. It's not designed to stretch or strengthen anything really. It's just designed to improve the movement of your back and your hips. So just coming up and down. Make sure you keep your head relaxed on the pillow or on the floor as you do this. And doing this kind of rhythmical movement can be really relaxing, and it's a great replacement for exercises in weight bearing that might cause more of a problem. The second exercise that osteoporosis sufferers should probably avoid is the bent over row. And the bent over row looks like this. So I'm going to use a stick just to demonstrate, but you'd probably be using a barbell. You're supposed to hinge forward like this, sticking the hips out and then pulling up on the bar like this. Now, this movement done with this kind of form is a great exercise. It's really good for strengthening the rhomboids and the lats at your back. However, what I see many people do is this, where they've rounded their spine and they're still doing the rowing movement, but their back is not in very good shape as they do that. Now, if you've got osteoporosis and you're moving a heavy weight up and down, even if it's a light weight, That movement there as the bar drops down is going to put compression on the spine and will increase the risk of a compression fracture. So I would avoid the bent over row and do a different variation instead. Let's have a look at the variation now. So this is a great alternative to the bent over row. It's called the band row or the cable row. And I'm going to use a TheraBand for this. You can get different strengths of these, but if you've got access to a cable machine in your gym, that might be better because you can change the pin to make it easier or harder. So if you're going to use a band like me, you need something just to wrap the band around that isn't going to ping off. And you're going to put both ends of the band in each hand like this. You're going to stand up really nice and tall, keeping a good posture. Just squeeze your bottom together just to stabilize the spine. And then you're going to pull the band in and back. So it's very, very similar to the bent over row, but we've basically just changed the position of your body so that there's no stress on your back, but we're still working the rhomboids and the latissimus dorsi in your back. What we want to do here is as we extend the arms, we want to round the shoulders, and as we pull back, we want to bring the shoulder blades back and in. Very similar to how you would in a bent over row, but again, less stress on the spine. We can still get a really good back workout doing this exercise. You'll get some workout to your biceps as well, which is a good thing too, without putting that undue stress down there. So use that as an alternative. It's much safer if you've got an osteoporotic problem, and hopefully it will help you avoid an injury. Before we go any further, I just want to tell you about 3 Tip Friday. 3 Tip Friday is my weekly email that I send out to my list, and it features 3 of the most interesting things I've found that week. It could be a health tip, it could be a piece of research I'm reading, or it could be a new tool that I've found to be really useful for helping people get more mobile. It's totally free. I just send it out once a week. There's no annoying promos inside, and you can sign up for it by going down below this video and entering your email in the 3 Tip Friday link. The next exercise that osteoporosis sufferers should probably avoid is the heavy deadlift. Now, I love the deadlift as an exercise. It's brilliant for improving strength in your glutes and in your back. And improving strength in those areas is vital for people with osteoporosis. However, the deadlift is a complex movement and it's very, very easy to get it wrong. So I'm not saying no to deadlifts completely. If you've got perfect form, it might be okay for you. I just think there's safer alternatives for people with osteoporosis. Now, the deadlift looks like this. Again, you would use a barbell rather than a walking stick, of course, and it's going to be resting on the floor to begin with. You would bend down and grasp it, and then you bring it up like this, and then you put it down by bending the hips and the knees. So this is the kind of deadlift movement, and you can see that whilst my back is straight, I'm probably very, very safe. But the danger here is when you become tired after you've done several repetitions, when you get down to the floor, this starts to often happen as people pick up the bar again. Can you see now how my back is rounded just as I'm about to pull up on the bar? And with the deadlift, we're often working with quite heavy weights in comparison to other exercises. So that is the moment that you're at risk of a spinal fracture. So having your back rounded like this obviously isn't a good idea. If you're able to keep this hip hinge throughout the movement, that's probably totally fine. However, if you want something a little bit less risky, I'm going to give you an alternative. Let's have a look now. So the alternative I'm going to give you to the deadlift is very similar. It's called the Romanian deadlift, or the RDL for short. And this exercise tends to be a bit safer for 2 reasons. The first reason is you're probably going to be using a lighter weight with the RDL than you would with the full deadlift. And the second reason is that it's easier to keep a proper technique with the RDL than it is with the full deadlift. So the Romanian deadlift looks something like this. Again, you're going to be holding a weight and you're going to be holding it very, very close to your body like this. And all we're going to do is we're going to keep the back straight throughout the movement, so the back never bends. We're going to stick our hips out behind us, and we're just going to allow the bar to slide down the fronts of the knees, keeping a very slight bend in the knee. And when you hit your limit by your hamstrings, which for me is about here, you're going to stop and bring the movement back up into reverse. Simple as that. So we're pushing out with the bottom, keeping the back straight. The bar slides down the legs. I can't go any further without bending my knees, so I'm going to stop here. So I'm only getting down to about my knee height. and then I put it back up into reverse. And I like this movement because it's still strengthening the glutes, it's definitely strengthening your hamstrings, but it also strengthens your back extensor muscles. And the research shows that for people with osteoporosis, they tend to have weaker back extensor muscles, and if you strengthen them, you actually decrease the risk of a fracture later on in life. Obviously, you have to get this exercise checked with your healthcare provider before you try it because it's not suitable for everyone, but that is a great alternative for many people who can't do the deadlift. The next exercise that you almost certainly shouldn't do if you have osteoporosis is the crunch or the sit-up. And a crunch looks something like this, or you can have your hands behind your head like this. You can see that I'm getting quite a lot of flexion in my spine, and I'm also moving quite quickly, which increases that risk. And the full sit-up would be more like this, coming up and down all the way through. Now you can see at this point here, I've got quite a lot of spinal flexion. Many people also have to jerk their way up to get right up to their knees like that, which obviously is going to increase the risk of a sudden movement, which can put stress on the vertebrae. And there is some evidence to show that that exercise is one of the #1 exercises that causes a spinal fracture in osteoporosis sufferers. So we want to avoid the crunch and avoid the full sit-up. And instead, we still want to work the core, but we can do so without flexing the spine. So I'm going to show you a great alternative to the crunch and the sit-up now. This is called toe taps. And what we're going to first of all do is work on activating the core muscles by just flattening that back gently down into the bed there. We're then going to bring one leg up here to 90 degrees and also the other one as well. So we've just got our legs hovering, keep the back flat, and we're just going to slowly drop one leg down and touch the bed or the floor like this, and then we're going to repeat on the other side. Now, you won't get quite as much of a burn in your middle abs here when you do this exercise, but it does actually better activate the entire core than the sit-ups and the crunch. So this is a super alternative. Obviously, what you would do is keep doing this until you start to get some fatigue. So you keep the movement going, only doing it to the point that you feel you can still maintain the back flat on the bed or the floor like that. If your back starts to lift up, you've probably done enough, so rest for 1 minute, repeat a couple of times over, and it's a super replacement for the crunch. The next exercise we almost certainly want to avoid if you have osteoporosis is the Russian twist. And this is another core exercise or an abs exercise that I see people do in the gym, and it's also been shown to put people at higher risk of a fracture because it involves flexion and rotation. So the Russian twist often involves a medicine ball, and you sit like this and you rotate it from left to right, keeping the legs up. So you can see here I'm in a flexed position and I'm also rotating at the same time. So if I do that too much and I overuse it, I am possibly going to put myself at a risk of an injury there. Again, it's not a bad exercise, but for people with osteoporosis, there are much better alternatives. So the better alternative for people with osteoporosis that I would recommend would be the side plank. And the reason I like the side plank better for these people is because it still works the transverse abs, which live down here, but it's a lot safer. It's also one of Dr. Stuart McGill's favourite spinal stabilisation exercises. It's one of his big 3. And the reason it's one of his favourites is because it maximises stability whilst minimising stress on the spine. So the side plank can be done in a few different variations. The easiest variation is to do it on your knees. So you would bend your knees like this, you put one elbow down like this, hand on hip, and just lift until your body is in a straight line. And then you can choose to either leave it there, or you can add in some clam movements or some leg lifts, or you can get the arm moving just to kind of adapt the contraction that you need in your core here. If you want to take it to the next level, you can straighten your legs out. You can put one foot in front of the other like this and lift back up again and repeat, holding that position for 20 or 30 seconds. You'll really start to feel the abdominals working down the side when you do this. And if you want to do the hardest variation, you put one foot on front of the other, you keep your body in a nice straight line, and again you lift and hold. If you want to make this really hard, you can obviously lift your legs up as well to get some hip activation, but just holding in a static position is enough to get those abdominals working, and is a great replacement for the Russian twist. So those are the exercises to avoid when you have osteoporosis and some great alternatives. I hope you found this video useful. If you have, do drop a comment below and let me know your thoughts because I love to read them. And if you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50 and you can find it on Amazon using the link below this video. It's got loads of advice on how to improve your muscle and your bone health and strength so you can avoid injury in the future. Anyway, thank you so much for watching. I appreciate your time and I'll speak to you on the next video.